Hey, everybody. Welcome back to the Outcomes Rocket Founder Stories. So excited that you joined us again because today I have an amazing person and leader with us. His name is Kevin Agatstein, and he's the Chief Executive Officer at KAID Health. Kevin founded Agate Consulting and via Agate, and before that, McKinsey and Company and Arthur Andersen. Kevin has advised providers, payers, healthcare IT companies, life science organizations, and healthcare venture capital firms and private equity firms. He's just an incredible person with a background from MIT. Had the chance to meet him in Vegas a few years ago at one of the health conferences. And I'll tell you, I've been impressed since day one. So I'm super excited to be having him as a guest here on the podcast for all of you to listen and see. Kevin, thanks for joining us.
Thank you, Saul. And remember the ground rules, right? Whatever happens in Vegas stays in Vegas. We'll start afresh here.
I don't remember what happened in Vegas, so that takes care of that.
My lawyers and my will be happy. Sounds good.
Amen. Amen to that. So, Kevin, such a pleasure to have you here with us. To kick things off, I want to dig into the founding story. What is it that inspired your work in entrepreneurship and in healthcare?
Sure. Two questions there. What started my work in healthcare and what started my work specifically with KAID? Maybe I'll break those apart. In healthcare, I've been doing this, and thanks for that bio, makes me sound smarter than everybody who knows me knows I am. But I got started pretty early in my career for a couple of reasons. One, I really like the complexity of healthcare, and I know that sounds trite, but I'll do some math. When I was at McKinsey, a partner who was a former engineer like myself said, business is pretty easy. You got revenue and you got cost. Make one bigger, make one smaller. For healthcare, we're solving a much more multifactorial problem here. Obviously, we have revenues and costs, and don't get me wrong, everything that I do on a daily basis focuses on that. But we have teaching, we have clinical care, we have research. We're just optimizing now, and now more importantly, staff satisfaction is what drives all of that. We're just solving a much more complicated problem, and we're doing it in a pretty complicated environment. We're heavily regulated, imperfect buyers, and I just loved that mess. And then I was really, for me, what congealed it was I was in a hospital. I'm tempted to say it was LA County Medical Center, but it was many, many years ago. And I just took a deep breath and I looked around, and this might, at the risk of sounding totally corny and cheesy, I'm not a religious person, but in this building that I was in, and it's true for all hospitals, it's a place of death, a place of birth, of healing, of hope, of violence and fear. And it was the gamut of human emotions playing out under this one building. Now, that made me kind of a believer. That was my calling, that I really want to do this. And I stayed in the business. That wanting to be part of it stuck with me ever since. And then, for starting the company itself, I've been in the business for a long time. And I'll give you the formal story of the starting of KAID, which includes market analysis and all the stuff that a good McKinsey consultant should have.
Yeah.
But the real story was I wanted my wife to come to bed. And, let's keep that PG rated. But my wife's a pediatric endocrinologist at Boston Children's Hospital. So she's dealing with a lot of sick kids. And one of the things that she does before clinic is, she's going to see a bunch of patients tomorrow. That night, she's in her EMR, which was, I believe, Cerner's Power Chart, now Epic. And she's sitting there reviewing tons of documents for this patient to get ready tomorrow. And it was an incredibly laborious task. And, it's 11 o'clock and, I was lonely. So I kind of got a sense of, not looking over her shoulder, HIPAA we take very seriously here, but ask me, what are you doing? And I'm, I'm trying to digest this hot mess, all these PDFs and all this stuff coming in from her specialties, so I can make sense, so I can have an informed discussion with her, with the patient tomorrow. And I was like, well, we're not going to be able to make a computer that's ever going to be as nice and as empathetic and charming as my wife, but maybe I can help her come to bed by digesting some of that, by simplifying that task for her, and maybe even flagging some things that get missed in that inherently noisy process. Started digging in, and this is right around the time Google came out with transformer technology around 2018, 2019. So advances in AI now made this possible. So, instead of a back rub or letting her watch Grey's Anatomy or her silly TV show, I decided to start a software company to get her come upstairs. Boston Children's still isn't a customer, and she's still working way too much, like so many providers around the country. But we've been had fun. Relatedly, and having in parallel, a group of us started a health system in Florida called the Villages Health about 13, 14 years ago. The Villages, it's the largest 55 and older community in the U.S., and it's famous or infamous or both at the same time.
I've heard of the Villages. Yeah.
Yeah, they a lot of golf, a lot of dancing in the streets, a lot of beer, and let's just leave it as some friskiness.
Yeah.
What
Yeah.
they're famous for, and
I hear.
what we've already talked about, bringing my wife to bed. We got to move this back towards the PG level here. So we started this health system, and similar to the challenge my wife was facing, they had several EMRs. They had transitioned from ECW to Athena, and their docs and their coding team was struggling with the same problem my wife was, which was all this information, many of which is PDFs, medical notes. You have claims coming in from the payer. You have all the structured EMR data, like labs. And nobody was taking ownership of pulling this all together. You had companies that would focus on one data set, like an NLP of the notes. You had other companies that would focus on the labs. You had other companies that would focus on the claims. But nobody cares about that. They care about the patient. So the same problem that my wife was solving from a clinical perspective, the Villages was really struggling with from a coding perspective, a quality reporting perspective, and a care management perspective. And, when you start to hear something repeatedly, albeit in different lens, as an entrepreneur, sometimes you just got to damn the torpedoes and try to fix it. And that's what I'm still trying to do. Still just trying to fix it.
Love it. And how long have you been in it? How long has KAID Health been doing what you guys do?
Measured in years, we've started about 4 years ago. The same four of us that started the health system was the founding board. Elliot Sussman from Lehigh Valley Health System, Steve Klasko, who's now advising General Catalyst, Larry Howard, another physician, private equity guy, and myself. Measured in hairline, I don't know if there's audio video. Probably
it is audio
my
video.
forehead, my forehead is I've lost about 3 inches. And that trend continues. A little bit of a tough time being in health tech right now, but more importantly, we are doing good, and we're doing good for the patients.
No, for sure. I love it. Hey, thank you for sharing that. And you know what, Kevin, it's a personal story, inspired by those emotions you felt in the hospital, then being at home with your wife. The opportunity has really evolved with the advancement of technologies, and in particular, I would think Gen AI. Talk to us about how that has impacted your business.
Sure. We are from a technology. There are two. I try to avoid hyperbole. Although or at least I say I try to avoid hyperbole. Whether or not I accomplish that's a different story. But there are two fundamental shifts going on shaping healthcare and healthcare IT right now. One is technology, and I'll get to Gen AI in a moment. The other one is kind of care model reform or payment reform. From the technology perspective, we see, three things that are really converging to make this particularly interesting. The continued digitization of health information. When I first started, we had no EMRs. I mean, I used to do work in operating rooms. We had paper anesthesia logs, and we'd pay a secretary to put them into Excel so we can do analysis. Now we have the opposite problem. There's so much digital information out there being captured by Epic, Turn, and Athena, and the other players. The second problem is it's getting worse. Many hospitals are investing in this EMR interoperability so that you can get records and share records with other providers. And it makes perfect sense, but at the same time, it exacerbates this data overload problem. Fortunately, we have this third technology, large language models, AI, including generative AI, that's hopefully the saving grace here, which is the ability to digest and homogenize these disparate data streams, remove conflicts, and really understand not just what's up with the patient, but the context. Claims data, problem lists in the EMR, et cetera, tell you the what. This patient has disease X, this patient has lab value Y, this patient takes medication Z. The real power of Gen AI and large language models is, especially when you have so much more data on the patient, is you can start to understand the context. This patient is a poorly controlled diabetic because of X, Y, and Z. This patient behaviorally seems to be very reluctant or scared of treatment for various reasons. And by able to get to these motivations in the clinical context, you're able to do so much more to understand the patient, to help the patient, and candidly also to take risk and code the patient. So that's the real power of AI. It's not just to do more of what we're doing today, reviewing a chart, dropping a code, filling out a quality report, or calling a patient and say, I'm here to help. It's being able to take that discussion or that interaction or that code to the whole next level and an entirely new level of detail that was just never possible when you have somebody manually writing a note, another person manually reducing those to a few simplistic claims, and then hoping that the truth can be gleaned on the back end. And payment reform, as I mentioned, is really what all innovation takes cash, and it's the payment reform and frankly Americans, purchasers to government, employers, and patients getting just dissatisfied with paying for more and getting less. That's prompting that investment in these new tools.
Yeah, I love that. And is there anything in particular in payment reform that stands out as, an opportunity or game changer for you?
Yeah, so a game changer and also a little bit of you mentioned this was focused on founders, so
Yeah,
I'd love to share a couple of scars
please.
related to that. Without a doubt, there's a general movement, and I'm sure your listeners have heard ad nauseum about this, is the move to providers themselves taking financial and clinical risk on the patient. They're the ones between the payer, the employer, and the government, and the provider in the exam room. The provider has the most ability of those four to effectuate better care, to recommend the right treatment, to more empathetically guide the patient through his or her journey, to impact resource utilization. So this movement of pushing more and more financial risk on the patient, just on the provider, just makes a ton of sense. Kaiser's been doing it for years. A lot of providers, like the villages, um, have done a great job of implementing these models, and so that's the movement. That general movement from fee for service to accountable care organizations to capitation has been wonderful, and it's in general the right, very supportive of that. There was a lot of enthusiasm for that model of providers taking full risk early on, particularly in private Medicare, Medicare Advantage. And that's when we started the company. That's really where we focused initially. And the lesson learned there was, at the end of the day, the government's still the biggest buyer of healthcare services in the US. And when the government likes something, you want to be selling that. And we were supporting people who were selling this model of full risk in Medicare Advantage. When the government changes their mind, whether or not it's for policy or politics, as an entrepreneur, you ain't going to be able to shape governmental behavior.
Right.
Uh, Lobbying is for the United and the Ascensions of the world, and even they have only so much voice. You got to be able to adapt and move quickly. When CMS really changed some of the payment methodologies for Medicare Advantage, it became a moment that really forced us to say, what is it in our DNA that we really want to do here? And it
Yeah.
wasn't just support one type of patient and one type of payment model, but it was really retrenched back to our roots of understanding all this data for clinical purposes. And it ended up being a blessing in disguise. We now have a bigger addressable market and really an entirely new set of customers that we have and are going after. But a lesson for the founders here is aspirations, ambitions are great, but at the end of the day, if you're going to work in healthcare, pay attention to the regs and watch the wins in Washington and the State House, because it will matter to you.
Yeah. No, that's a great message, Kevin, and congrats on being able to shift with those regulations and really just build a new business with the I don't know, would you say new value prop or modified value prop?
I would say that our North Star, a guiding principle, was still how do we aggregate the 80% of data that lives in that a patient has that's unstructured with what's already structured to create a unified picture of the patient. That's our North Star. As I mentioned, that was my failed attempt to get my wife to come sleep with me. But that's not changed. How we monetize that platform, whether or not we're focusing on Medicare Advantage, risk adjustment, HEDIS and quality reporting, fee-for-service coding, clinical trials, prior authorization, care transition to care management. There's lots of different users of clinical data beyond just creating a bill. And it really forced us to open our lens a little bit. It wasn't a pivot. I mean, we still earn our keep primarily in the Medicare billing accuracy and completeness space, but it really allowed us to remind us that stop focusing on the commercial problem, stick to the roots of the clinical problem, and have that faith that if you do the right thing for the patient, you keep your eyes open for what the payers are saying, what your purchasers are saying, success will come out of the back end. And we've just had a great quarter, several new wins, and I'm really a believer. Do right by patients, do right by docs, and protect data security overall, and good things will happen. Keep innovating.
That's awesome. No, I think that's great, and I appreciate you sharing that, Kevin. Ultimately, it got you guys focused even more on that North Star. Kevin, I love that, and so I was actually, before getting on with you, looking through your site, and back to sort of what you were talking about with your wife, right? It's the reduction of time looking at charts, oftentimes called pajama time.
Yep.
I saw on your site that it was reducing it on average from 55 minutes to 9 minutes. Talk to us about that.
Yeah. So if there's a leitmotif running through most of our kind of strategic discussions, it's time. I mean, healthcare, we sell time, right? We're trying to sell years of healthy living, right? That's our ultimate product. For physician time and clinician time, why we started KAID, and if you'll indulge me, the genesis of the name KAID comes from the Hippocratic Oath, which is, I'll remember that medicine is much as an art and a science, and that warmth, empathy, compassion can often outweigh the surgeon's knife or the chemist's drug. Long way to say, there's a lot of technology that helps with surgery and procedural medicine, the K. There's a lot of technology that helps with the D, the drugs. That third treatment pillar, procedure, drugs, warmth, empathy, and compassion, commonly caring or empathy. That's the one that's been hardest to automate, right? We have Pfizer that spends billions on technologies, and we have Da Vinci robots and all this stuff for cutting. What can AI or technology in general do for that third treatment pillar? And let humans be humans and free up the rest of the crap that fills up the physician time and the clinician time. So we do a lot of time and motion studies here at KAID for our technology. The one fact I think you were alluding to is for retrospective chart review, when you have a big pile of thousands of pieces of paper, and in that case, we were reviewing cardiovascular codes, they were spending 55 minutes looking at a chart, and they were able to get that down to 8 minutes. And in doing so, they were able to find more than they were finding in the 55. So you're able to do a lot more or less. Other situations haven't had quite the profound results. Oncology charts are a little bit harder to read. Pre and post-operative notes take a little bit longer, but you're always seeing the 20, 40, 50% compression of time with no degradation of quality. That is really KAID's gift to the ecosystem. And the hope is not that we're able to just make people work harder. It's like if you cram more seats into it, if you make an airplane bigger, you can give people more legroom where you just cram more seats in. We'd like to think that our customers maybe they're adding a few more seats to make some more money, but they're also giving the docs a little bit of legroom to do what they do, which is that warmth, empathy, and compassion that only they can do. And if we do contribute to that, it'll be several years and several inches of hairline well spent.
No, that's fantastic, Kevin. Really appreciate that. I love how you've summarized this, and really giving people the ability to care and be more compassionate is one of the biggest gifts. I couldn't agree with you more. This has been
a lot of revenue, by the way. I mean, don't think. I mean, all the theory aside, we still find a lot of revenue for our customers too, right? So, I mean, we're dropping codes left, right. So, I don't want that to get lost. But there's more to this industry than just dropping codes, and that's what we're trying to do here.
And nowadays, that's the table stakes, right? Like you have to find that revenue.
Yeah, you have to do both. I mean, I think there's this expectation that you see things like phrases in the literature like vendor consolidation or cost reduction or insourcing. You have to have financial, clinical, operations, and data security. All four. You have to serve all four of those masters, or you're just not going to make it. And
yeah. And who do you typically who typically works with you guys? If you want them to hear this message, who's the stakeholder?
Typically, it starts with the head of revenue cycle, the head of population health or quality reporting at a provider organization that every day has a pile of thousands and thousands of pages that they need to get through to understand the patient, and that there's some money to make it better, right? I mean, when you put those two forces together, we can usually have some fun with them and help them along the way.
Amazing. Appreciate that. So for all of you rev cycle leaders, pop health leaders, take a look at kaidhealth.com to find out more about what Kevin and his team are doing. Kevin, it's incredible to hear your story, how you guys started, the things you've done to innovate, to add more revenue and more time to providers and leadership teams. What closing thought would you leave us with?
I think it all comes down to, pulling together healthcare entrepreneurship, at least healthcare IT entrepreneurship really comes down to, great technology. And these days that includes plumbing, block and tackling, movement of data and interoperability, as well as AI. Great clinical, to the extent that your product is informed by clinicians or coding staff. People still matter. And it's not just technologists, but the clinicians that can bridge that world really matter. And I'm a healthcare geek, right? So maybe I overvalue domain expertise, but more and more innovation gets, as the problems get more and more complicated, the whole model of entrepreneurship. My dad was a patient and the system was broken, so I'm going to fix it. Which we saw a lot of certainly during the dot-com boom, and then most recently in Silicon Valley. There's a role for that, but it needs to be tempered with an intimate understanding of the regs, of data security, of provider workflow, existing IT infrastructure. So there's a role for us geeks still to help with some stuff.
Love it. Yeah, so well said and so well wrapped up, Kevin. Really appreciate you jumping on with us. Love the work that you and your team are doing at KAID Health. Folks, take advantage of reaching out. Check out the show notes. We'll leave ways to get in touch with Kevin, his team, and the kaidhealth.com website. Kevin, appreciate you being with us.
It was fun, Saul. Thank you so much. Really appreciate it. Bye-bye.